Time now 6:06. Medical staff, not just here in North Alabama, but across the country, have been on a roller coaster ride since early March when the pandemic started really to surface in our area.
Now, many of them are seeing firsthand how quickly things can go from manageable to overwhelming. Joining us right now via Zoom this morning, Kathy Woodruff. She's the Chief Nursing Officer at Marshall Medical Center. Kathy, thanks for joining us this morning.
Thank you for having me.
You bet. Hey, we understand the last few weeks have been very challenging for Marshall Medical Center. Walk us through what you've experienced in terms of capacity and patients there.
Sure. You know, a couple weeks ago, we had a very heavy increase of COVID positive patients. At one point, we had 36 COVID positive patients between both facilities, which doesn't sound like a lot, but we're two small hospitals. And it really strained our system. We were at capacity and we didn't have very many beds left, and it was very stressful.
During yesterday's news conference, Kathy, the panel there, you guys stressed the importance of wearing masks and still following those social distancing and sanitation guidelines. From a medical standpoint, you see the mask working, right?
Yes, ma'am. You know, we've had a decrease in our cases over the last week, and I can't help but hope that the fact that people are wearing masks and are being more vigilant about hand washing and social distancing, that it seems to be helping. We've seen a decrease in the number of the patients coming to the emergency department. This all could change tomorrow, but I am cautiously hopeful that the masks are making a difference. And it makes a difference for us in the hospital. We've been wearing masks for a long time, and especially the staff that work taking care of the patients. You know, they're close together, and we've had very few staff members that have passed the virus along to each other.
You know, Kathy, there's a lot of people that still are not complying with that statewide mask order. It's got to be frustrating for you guys from a medical standpoint. What can you say to appeal to those who are still maybe hesitant or not wanting to wear masks?
You know, the mask issue has been controversial from the very beginning. The way that I kind of look at it and the way that we encourage our staff and our family members and friends is to think about it not from a personal perspective, but you're helping others. And that, you know, just in case you were to have the virus, maybe you're one of those asymptomatic people or you have minor symptoms, you might pass it along to someone else unknowingly who doesn't tolerate the virus well. So we encourage everybody not to be selfish about it, but to think about others.
And that really does bring it home, doesn't it? How important is it to make sure that people who need emergency care right now for non-coronavirus related issues still get the help that they need from the ER?
Yes, we want to encourage anyone and everyone that has non-COVID issues to please continue to come to the emergency department. We have everything in place to keep you safe. We've divided our emergency departments up, so we have a respiratory side and a non-respiratory side, so you can feel safe coming in. We'll take great care of you. We don't want you to wait until it's too late.
Kathy, do you have the current numbers right now for inpatients in your center?
Yes, ma'am. This morning we have 25 total between both facilities. And we have 5 in each of our intensive care units for a total of 10 patients in the intensive care units.
And about 20 seconds left right now. Talk to us about morale of the staff there.
Sure. You know, the staff are tired. They've worked really hard. This is emotionally and physically tiring for the staff, but they really come together as a team. They help each other. They know this is what they're here for. You know, when we all chose healthcare as our careers, we realized there would be times that were going to be like this, but we're here for our community, and we want to help everybody, and, you know, kind of keeping that in the back of our mind helps us stay positive in a time like this.
It's you folks calling. It's your calling for life. We salute you once again for doing what you're doing out there, and we do appreciate you coming on this morning. Kathy Woodruff, Director of Nursing for Marshall Medical Centers. Thanks for being here.
Thanks for having me.
Time now 6:10 on your Friday morning.